It's not breaking news that smoking is bad for you.
But the way people use tobacco is changing, and some products even claim to be healthier. So what's what? SSM health physician and wellness coach Dr. Roopa-Shah joins us this morning. Good morning, doctor.
Good morning, guys.
So let's talk about what exactly about smoking and tobacco products is bad for you.
So it's actually the nicotine is what keeps people using these tobacco products, and that's highly addictive. But it's really the thousands of chemicals that are contained in the tobacco and the tobacco smoke that makes the habit so deadly for people. It's the toxic mix of those chemicals that leads to lung diseases, cancer, COPD. And we know that traditional cigarettes pose the biggest risk because they deliver more than 7,000 different chemicals along with nicotine. And then all of that just makes it harder to quit for folks.
Are some of these alternative products actually better for you?
Well, it's kind of a tricky question because there is, you have to think of it as like a continuum of risk. So the FDA has approved some of these nicotine replacement products, to help people quit smoking, which is wonderful. Nicotine patches, gum, lozenges, so they carry the least amount of risk. But the big debate really recently has been about, of course, cigarettes and vaping. And the FDA really is saying that more research is needed to see what the long-term health benefits or health effects will be, and if they truly are more harmful than traditional cigarettes or not. So there's not enough evidence yet to say that e-cigarettes are better for quitting smoking or if they're safer than traditional cigarettes.
So we know nicotine is addictive. Is there something about the product itself that is harmful?
So nicotine is just a highly addictive chemical, and it really changes the way that your brain works, and it can cause those cravings. As we mentioned before, it's all those chemicals that are contained in the cigarettes that are the big problem. The American Heart Association points out that nicotine can cause an increase also in blood pressure, heart flow, narrowing of the arteries. So there's a lot of cardiac issues that nicotine can cause, especially like hardening of the arterial walls, which we know can lead to heart attacks and strokes.
So bottom line, we know that these products aren't good for you, but for what age group especially are they not good for?
So our kids and our teens, really nicotine can harm that really developmentally important stages for this age group. It can affect the part of the brain that controls attention, learning, mood, impulse control. So brain development, we know, continues into the early 20s. So if kids start using these products too early, we're going to see alterations in their moods and development of their brain.
All right, doctor, if folks want to see you on social media, where can they find you?
They can find me on Facebook or Instagram at Wellness with Dr. Shah.
All right. Thanks, Dr. Shah. Always good to see you.
Yeah, you too. Thanks, guys.